Hello and welcome to a new week. How was your weekend? Hope you had a nice time with family and friends. It's another episode on the Aunty Pharmacist podcast, and guess what I'll be discussing with you today? It is one thing that always causes fight between patients and their healthcare providers, especially the pharmacists. And this issue is medication adherence. You know me, I like discussing issues because that is why this podcast exists, to bring to your attention these issues that we have to address. So, picture this scenario. Mr. Tunde comes into the pharmacy with a prescription from his doctor. It contained amoxicillin and antibiotic to treat his otitis media. So the pharmacist dispenses the medication with instruction to take one capsule every 8 hours for 5 days. Mr. Tunde knows in his heart of hearts that he's not a fan of medications. He collected it and left. The first day, he took the medication at 7 a.m., then at 3 p.m., and later at night at 11 p.m., just before he slept. On the second day, he took one capsule after breakfast, and he was in a rush to leave home for work, so he forgot to take the medication along with him. He got home very late that night, but managed to take the medication at 9 p.m. just before he went straight to bed because he was exhausted. The third day was a weekend, and so he slept in and woke up late at around 11 a.m. On waking up, he remembered his medication and quickly took it around 11:30 a.m. after having 2 slices of bread, and realized that he feels much better now, so he didn't bother to take anymore. After all, the reason for which he's taking it has resolved. His throat isn't scratching him anymore, and the pain he was feeling in his ear is gone. Fast forward to 3 weeks later, he starts feeling the same symptoms again. So he decided that instead of going to the doctor this time, he should go straight to a pharmacy and see a pharmacist. He entered the pharmacy and complained to the pharmacist, who also brought out the same amoxicillin for him after listening to his complaint and symptoms. On seeing the medication, he frowned and said, "Please, give me another medication. This one does not work for me." The pharmacist then asked why he said so. He said, "This medication is what I used 3 weeks ago, and now I'm feeling the same symptoms." The pharmacist now goes further to ask how he took the medication. Mr. Tunde starts mumbling. I took it 3 times daily." "For how many days?" the pharmacist asked. For I think 3 days. Then the pharmacist smiles and tells Mr. Tunde to take a seat. So this pharmacist decides to school Mr. Tunde on the issue of adherence. Guess what? You are Mr. Tunde. You listening to this podcast are Mr. Tunde. And so is most of the people that take medications in this day and age. Medications adherence is an issue almost everybody that takes medicine is guilty of in one way or the other, which is why I think that it is better to bring it to our attention at this point in time. You see, a lecturer of mine said something a while back. He said, "You can prescribe, but you can't prescribe." This means that as a doctor, for example, you can prescribe a medication to a patient, and as a pharmacist, you can dispense this medication with instructions to take it, but you cannot force the patient to take it the way you told them to. After all, you can't follow them to their house and monitor them. It's like the adage that says that you can take a horse to the river, but you can't force it to drink water. Now, let me define medication adherence. It is the act of taking your medications as instructed by your healthcare provider, like to the letter. It is taking the medications at the right time and for the right duration. That is the only way it will serve the intended purpose in your body, which is to solve your health condition. In the past, this was called compliance, but as pharmaceutical care evolved, it was renamed to adherence, because compliance is like you are following a law. You do not have any choice in the matter. But for adherence, it's like an agreement between the healthcare provider and the patient on the best way to use their medication in order to get the highest benefit from it. This is why when you go to your neighborhood pharmacy and you're handed a medication, either you took a prescription there or you made a complaint to the pharmacist for which they gave you your medication, they give you the instruction in a way that you understand it. They will not just say, "Take this 3 times daily," or morning, afternoon, and night, because this could mean different things. If they say 3 times daily, you could decide to take all in the morning as long as it's 3 times, or all at night, you understand? And if they say morning, afternoon, and night, You could decide to take it late morning, early afternoon, late night. There will be uneven interval between the doses of this medication. But you are told take this every 8 hours. There are 24 hours in a day. So you have to divide these 24 hours into 3 and take every 8 hours. Now, it is left to you to choose your convenient time to take it. Just make sure that it's every 8 hours. If you're a late sleeper, you could decide to take one by 8 a.m., another by 4 p.m., and another by 12 a.m., depending on you. Or you could decide to take very early by 6 a.m., take another by 2 p.m., and the last one by 10 p.m. But as long as you take it every 8 hours, or at worst, an hour shorter or longer than the normal hours you were told to take it, then you have adhered to the medication instruction. But anything outside this is non-adherence, and this causes a lot of problems. This is the major reason for treatment failure these days. You see a patient go into a pharmacy and accuse the pharmacist that the medication they gave them did not work. They could not treat their conditions. Or they say, I've been to several doctors. They were not able to treat my condition, which is why I'm here. I'm not saying that there are no other things that cause therapeutic failure, but one major one is medication non-adherence, and which is what I'll be discussing with you today. I'll be telling you why you need to adhere to your medications and how you can actually achieve it. I know it's not easy with the hustle and bustle of these days. With how busy people get, you might forget your medication, which is understandable. Even the best of us do. The healthcare professionals themselves that give you these instructions, because, well, we are all human, but there are ways around it in order to get the best benefit from your medication and not to waste your resources. Let me start by explaining to you the reason for particular dosage of different medications. Medications are supposed to reach a particular level in the body before they elicit their therapeutic action. This is known as the minimum therapeutic concentration. It is like the reservoir in your house. When you pump your water, it must get to a particular level before this water can reach your taps and before it can be accessible for you in your house. Now imagine you pump your water, but it does not get to the level that will distribute to the pipes. Then you will not get any benefit from it. You switch your pumping machine off just before it gets to that level. Then you will not have water in your house. The same thing in the body. The blood is the one that carries these medications throughout the body. There is a particular level this medication must reach in your blood before you start seeing actions. And this usually happens after the third half-life of a medication. Now, half-life is the time it takes for a medication to reach half of its concentration in the blood. Not only is this medication concentration increasing in the body, at the same time, at this particular half-life, it is also reducing in the body. Both processes are taking place at the same time. This is why you have to replenish this medication every half-life so that that particular minimum therapeutic concentration is maintained for the action to continue. If you do not replenish this drug at the half-life, the drug continues to drop to half its original concentration till it is completely eliminated from the body. Then you don't have it in your system anymore and there is no action. There are a lot of technicalities which I will not bore you with, but just know this, that if you were asked to take a medication every 8 hours for 5 days, you must take it for that number of days. Do not take it for 3 days and stop. Especially anti-infectives. What these medications do is that they kill a particular organism. They attack them, either they inhibit or kill them. Now you have taken this medication judiciously for the first 3 days. You see your symptoms subsiding and you do not see any reason to continue. This is wrong in the sense that these organisms, of course, some of them have died because the population reached in the body that caused the disease in the first place has been reduced. But imagine you now stop this pressure this medication is exerting on them. These organisms are also trying to survive, just like you and I. They are living organisms. So you stop giving this medication, the medication concentration reduces in the body, and the organism sees an opportunity to start growing again. They just multiply exponentially, and before you know it, it's like the proverbial demon that you were trying to chase out. But since you have left the place empty, it comes back with legions. The same way, once this medication has reduced the population of microorganisms to a level and you do not increase the pressure to eliminate them totally, you give them chance to grow back again. They could even be multiple of what they were before. Now the condition returns, just like Mr. Tunde's condition. And this time, do not be surprised. This same medication will not be as effective as before. Why? Because these organisms are also intelligent. They have their ways of combating this medication. The first time you gave it to them, they have studied it. Now the organisms are wiser. They know how to combat this medication to reduce its efficacy. If only you had used it as you should the first time, you would have eliminated them completely. I won't have to repeat the medication again. This time, it being less efficacious than it was the first time. That's in the case of anti-infectives. What about medications that act directly on the muscles without killing any organisms, like our normal pain relievers? There's something called tolerance. After a while, once you start giving the medication again and again and again to a particular level in the body, it gets to a point where you require double that same dosage for it to elicit its action. Now, there are consequences of non-adherence. The first one is therapeutic failure. What you are taking this medication for will remain because the purpose will be defeated. Since the blood level is not achieved, the condition will not be treated. So you spend more money on repeated hospital visits. That is another consequence. You'll be spending more for what you are supposed to have spent less. Another very important one is antimicrobial resistance, especially for antimicrobials like antibacterials, antifungals, antimalarials, that actually inhibit or kill a particular organism. Since you did not adhere to your medications, this organism become the wiser. Remember, these organisms are also intelligent. You may not see them with your naked eyes, but they are living things and they are looking for ways to survive. They will learn ways to dodge the action of your medication, to resist this action. Before you know it, you take the same medication and it doesn't work again. This time, they have become stronger than the medication. And this leads to increased morbidity. That is, the disease condition persists. If it is one that can be transmitted from one person to another, then you start spreading this disease that should have ended with you. And now, remember, you are transferring even stronger microorganisms to the next person, that the medication you use may not work for that person as well. And the last one is increased mortality. There are infections that should be treatable with simple antibiotics, but due to resistance that has built up due to non-adherence in the first place, these microorganisms continue to persist. There is no medication that can treat them anymore because they are resistant to them, and the person dies, which should not have happened in the first place. Also, in case of diseases like diabetes, hypertension, medication non-adherence leads to death eventually because your BP continues to rise without being controlled. So does your blood sugar level. At the end of the day, leads to end organ damage and eventual death. Now, I will tell you ways to combat medication non-adherence. The first one is be in agreement with your healthcare provider. If you know that you are one with a very tight schedule and you will not be able to take it, or you just don't like medications generally, let your healthcare provider know. If there are other options that will be more convenient for you, maybe instead of 3 times daily dosage, there might be another medication that you can take just once daily and will do the same thing, or at most twice daily. Then they will give you this other option instead of taking it and know that I'll just take it for 2 days. Once I feel better, I will just stop using it. You are doing more harm to yourself than good. Another thing is, if you know that there's a particular side effect you feel from taking a medication, tell your healthcare provider. Like I said, they will give you another option or give you something to combat that side effect so that you can take your medication seamlessly without any complications. Another thing is involve a family member. Once you are taking a medication, if it's not something secret, if it's a simple antibiotic, for example, let your spouse or your siblings or your friends know, oh, please remind me to take my medication at so time. It is better than to keep things to yourself and the condition will persist. At least these people will be there to remind you. Even better still, technology has made it so easy that you can set reminders on your phone. Just like you set tasks for meetings and all, set reminder on your phone for taking these medications. Then put them in places that will be easily accessible to you, where you will see them easily, because out of sight most times is out of mind. If you do not see these medications, then you may forget to take them. If you know it's something you have to take more than twice a day, that means you have to take them when you're at work. Then put them in your office bag, not on your cupboard in the room. You may forget it that way. For those treating acute conditions, these are ways by which you can combat medication non-adherence. But for those taking medications for chronic conditions, I know how difficult it can be to continue taking medications for long periods of time. It can be tiring. But there are also ways by which you can make it easier for yourself. And truth be told, most of the medications for chronic conditions are usually taken once daily, especially antihypertensives or antidiabetics, for example. You take them once every day, so you can choose a convenient time, maybe in the morning or at night. But the problem now arises when you are taking more than one medication at once. That is what we call polypharmacy. But there are still ways around it. There are pill organizers where you can group your medications and put it somewhere you can see it, so that the medicines you will be taking on Monday, Tuesday, Wednesday, they are all organized. You just take them all at once. Besides, there are combination tablets that contain 2 or 3 medications already combined in a tablet to make it easier for you. So this way, it becomes easy for you to take your medication. Just one pill will cover like 3 or 4. And like I said, for the acute condition, let your family members be involved. They'll be the ones to remind you most times. Generally, most medications are taken at most 6 times daily. And those that have to be taken 6 times daily, they are very uncommon. They can be like lozenges, for example, but those ones are easy to take. They are like sweets. But others that you have to swallow, at most you take them 4 times daily, that is every 6 hours. There are some that even allow for 3 times daily usage, whose half-lives are between 6 to 8 hours. So I don't see any reason why you should be missing your medications and being non-adherent. The greatest excuse most people have is, I'm too busy. But I've given you ways out. Make these medications very available, let them be around you, and set your reminder. I'm sure that you'll not be too busy to take your medication. Alright? Remember that the reason why you're taking this medication is to treat your condition. What then is the essence of wasting your time, your money, your resources, if at the end of the day you do not get benefit from these medications? If you miss a dose of your medication, take it as soon as you remember. If this period when you remember coincides with the time you should take the next dose, please do not take a double dose of the medication. Contact your healthcare provider. Depending on the medication, they will give you the right advice. Because taking a double dose might be causing more harm to you than good. You might actually be taking an overdose at that particular point. Just take one and continue. The blood level will be reached after 3 half-lives, like I've said. Remember that medications are not food, so you should not take them at random. They are regimented for a reason. And do well to follow the advice of your healthcare professional on taking your medication. Adherence is the only way you can get the maximum benefit from your medication and treat your condition optimally. So, before you start blaming your healthcare provider for incompetence, ask yourself, have I taken this medication as instructed? Only after this can you look at other reasons why your medication did not work for the condition for which you're taking them. I hope that I've been able to pass my message across to you today. Be medication adherent. It is for your own good. So I'll see you on Friday. Remember to share, like, follow, and subscribe to the Aunty Pharmacist podcast. Also, your questions and comments are always welcome. As usual, you can reach us via our mail at auntipharmacistpodcast@gmail.com. And now we are on Instagram, so you can follow the Aunty Pharmacist podcast on Instagram. Till next time, stay healthy and God bless you.